This is Mira, Institute for Biomedical Technology and Technical Medicine of the University of Twente in the Netherlands.
The aim of Mira is to provide a foundation of excellence in biomedical engineering and technical medicine, and then most importantly, translate this into clinical practice. We want to provide top technology for patients.
At Technical Medicine within Mira, teaching and research focus on practically applicable innovations in patient care.
Technical medicine fills the gap between the regular medical training and the medical technology. An average physician is not trained in applying technology for treating patients. And what we are providing is exactly that, technology in order to create a technical physician.
Technical medicine works, for example, on new applications in robot technology.
We are doing state-of-the-art research to epilepsy. We apply magnetic pulses to the brain and see how the brain reacts to these pulses. And then we can make a diagnosis for epilepsy, even when the patient doesn't have a seizure at that moment.
Research at Mira follows 3 different tracks. The first one is tissue regeneration.
The track tissue regeneration aims at restoring, or even better, regenerating the functioning of tissues and organs that have been damaged or worn out. We focus for a large part on bone, cartilage and cardiovascular replacement, but these days we also venture into organ replacements. Think, for example, of a pancreas.
I'm working on the development of a new therapy for type 1 diabetes patients. The islets of Langerhans of these patients are damaged and the production of insulin is hampered. So a possible solution for these patients could be the transplantation of donor islets. And to be able to transplant the islets in the patients, you need a carrier for these islets. I'm working on this carrier, to develop this carrier in such a way that the islets function properly and that blood vessels can grow in as quick as possible.
Neural and motor systems examines the interplay between brain, nerves, muscles and the skeleton. It develops technology that is driven by specific clinical needs from healthcare. For example, the Lopez.
Lopez is a gait rehabilitation robot. It is supposed to help stroke survivors in their walk training. What it does is that it measures how the subject walks in the robot, and the robot compares that with a reference, and if there is a deviation, then the robot exerts a torque or forces to help the subject in walking. By using this robot, a therapist can easier apply the training to a stroke survivor that he needs.
The third track develops new imaging and diagnostics technologies to detect and visualize illnesses. The goals of these innovations are to establish the exact conditions faster and more sensitively, earlier in the disease cycle, in a manner that places as little stress as possible on the patient's body.
The photoacoustic mammoscope is a new technique for imaging the breast. We combine light and sound imaging. We send laser light to the breast, which is absorbed by the blood cells around the tumor. And this absorption in turn causes a sound wave, which we can detect with an ultrasound detector. By analyzing this sound wave, we can get information about whether or not there is a tumor in the tissue. First of all, this method doesn't make use of ionizing radiation, so it's unharmful for the body. Secondly, it's much more comfortable for the patients, since the breast is not that much compressed as with mammography. And at last, it can be applied in the whole female population, and not only in the younger or elderly patients, as in mammography.
In order to make this kind of expensive technology widely available for patient care, Mira encourages the establishment of spin-off companies. For example, Progentics. This company is distributing a new method for bone growth in the body.
We make calcium phosphate ceramics. Those are small granules of a material that after implantation in the human body really induce bone formation. So they attract stem cells which are then stimulated to form bone. Progentics is still quite a small company. We have 20 people, mainly working in research, development and production. The commercialization of our product is being done by Nuvasive, which is a number 5 spine company in the US. They have their own sales organization, 300 salespersons, and they are going to do all the clinical studies and commercialization.
Mira already has dozens of companies associated with its research, but we want to expand. We expect in the coming years in between 3 to 5 spin-offs per year, but perhaps even more importantly, we want to create spin-offs of a certain size. So one of our key performance indicators is to create at least 3 companies with more than 15 people.
Developing this kind of technology and therapies, training students as technical physicians, and distributing the new technology through companies, these goals are the mission of the Mira Institute.